If you're a runner that's struggling with knee pain, Achilles tendon or ankle pain, plantar fasciitis or foot pain, or even low back pain, and it feels like you've tried all the things and you're still not getting better, I'm here to talk to you today about what you could be missing and what to do next. Hi there, I'm Dr. Lynne Virant. I'm owner and physical therapist at The Movement Clinic in Pensacola, Florida, and I work with runners all the time who are struggling just like you, and I help them break through these patterns, overcome these roadblocks, and get back to running to their full potential. So first, knee pain. Most standard approaches have you working on strengthening or stretching just at your knee. They ignore the key parts of your ankle or your hip. So how do you know if your knee is not the issue and you need to look elsewhere? Have a seat in the chair and hug your knees. So all you need to do is take your leg and give it a big hug and notice how much I'm bending my knees. If you can do that and you don't have knee pain, it's probably not a knee issue. You need to take a look at your ankle and your hip. Your leg functions as a full chain from your foot all the way up to your hip. So if you're only addressing your knee, you're missing 2/3 of the problem. And by addressing the whole leg, you can actually unlock your full potential. What a running form specialist or a physical therapist who specializes in running will be able to do is determine what's happening at your hip and your ankle that's causing your knee to take on all that stress with your running. So next, Achilles tendon or ankle pain. If you're struggling with this, typically what you'll get are stretches and calf raises. That approach doesn't address why your Achilles tendon is taking on all that stress in the first place. So here's what I want you to do. Feet together, take a step, and then shift your weight forward or back. If you feel like that's in your Achilles, then it actually might be more of a hip issue, or if you feel it stuck in the bottom of your foot, it also could be a foot issue. So if you did that stretch and you felt it in your Achilles, what you could be finding is that you're using your ankle too much for push-off and not enough your hip or your foot. So again, a physical therapist or a running form specialist will be able to determine where are you lacking so that we can take the stress off that Achilles tendon. So if you're dealing with plantar fasciitis or other kind of foot pain, you've probably been prescribed orthotics, night splints, or targeted exercises that just address your foot. But isolated movements only focus on your foot and don't address the fact that most issues at your foot can be due to movement patterns that go from the ball of your foot even all the way sometimes to your neck. And those are some things that need to be addressed by a running form specialist. But one way you can test yourself is to roll your foot. And when you roll your foot, you don't want to be aggressive, and you can find that probably other areas of your foot move well. So why would that one area be hurting? Again, a physical therapist or a running form specialist will help you determine what are the areas that you need to improve so that you don't just get temporary relief, but long-term relief that can help you to keep running stronger and for life. So how do you know how to roll your foot? Check out my video to show you exactly how to do that. Another common issue is low back pain. In fact, I just recently had a runner come in. He couldn't even do his speed work because his back was bothering him so much. And the thing is, we'll give you a lot of core exercises and we'll tell you how to stretch, but they don't really address why your back is bothering you when you're running. So here's one way to figure out if it's more than just your back. As you did earlier, feet together, and then instead of just shifting forward, you're gonna turn right to left. If you start to feel that in your lower back pain, similar to when you're running, it could be a sign that something's happening at your hip or your foot and ankle that's making your back do all the work. And the thing is, a running form specialist or a physical therapist will be able to assess you from head to toe to help you get those areas moving better and actually address the back pain. So if you find that you're struggling with any of these key issues, you're not doomed. In fact, when these standard approaches fail, it's not because something's wrong with you. It just means there's something else to discover. So if this sounds like you, go to getmovingpt.com to schedule a free 20-minute injury chat. We'll talk about what you've been doing and what your next steps could be. I'm a specialist in helping people overcome issues just like this, and I've helped numerous people get back to doing what they love, running. So if you've been struggling with hamstring tendonitis, IT band pain, hip pain, or shin pain, stay tuned for my next session. However, if there's any other issues you're struggling with and you're not sure why, comment below and I'll get back to you.